The Senate Health Committee has passed legislation to revamp health care, becoming the first congressional committee to act on President Barack Obama's goal of overhauling the system this year. The Health Committee voted 13-10 along party lines to pass a $600 billion measure. It would expand coverage to nearly all Americans by requiring individuals get insurance and employers to contribute to the cost. The bill would provide federal aid to families and individuals making less than 4 times the poverty level, or about $88,000 for a family of 4. And joining us now to discuss health care reform is Republican Congressman Bob Goodlatte. He represents Virginia's 6th Congressional District. Congressman, thanks for joining us.
Good to be with you, Bob.
Your reaction to the Senate Committee's passage of legislation today?
Well, it's very concerning. As you noted, it was along a party line vote, so there was really very little effort made to try to make this bipartisan legislation. I don't think anyone disagrees that we need health care reform, but this legislation and similar legislation working its way through the House is very troubling because it includes what's called a public insurance option, which means the federal government will suddenly be in the business of offering health insurance, and the estimate is that 2/3 of Americans who currently have private health insurance will lose that insurance coverage as employers drop them and push them over onto this public plan. Therefore, it's a slippery slope to national health care and all the problems of putting a bureaucrat between you and your doctor that would ensue. Secondly, there's a huge problem with the cost of this. The estimates are anywhere from over $1 trillion to nearly $1.5 trillion at a time when we're already running up enormous budget deficits, and the federal government is clearly in very, very deep financial difficulties as a result of the amount of spending that's been taking place here. It's absolutely stunning, and to try to impose this new legislation on top of that, when we already spend more on health care, both in total amount and in per capita, right now on health care than any other country in the world. We need to reform our current system. There are many good reforms that we could put in place, but I don't think this is it.
This measure, obviously the Democrats control both the House and the Senate now. What about the idea that all people basically would have to get insurance? That doesn't sound like too bad of an idea, does it?
Well, it's certainly not a bad idea to require people to have insurance, but bear in mind that when you set that system up and at the same time limit their options by creating this government policy that is basically going to put the private health insurance business and all of the different alternatives that people can choose from now out of business, you're going to lose choice in terms of your health care, in terms of what options you're going to have when you need to have help. And I think that, along with the cost of health insurance, are the 2 biggest concerns that most of my constituents have who have contacted me. The choice is going to be a big loser in this legislation if it passes. Now, one note of optimism is that there are a lot of Democrats in the Congress who do not like this either, and they have been resisting it both in the House and the Senate. Whether that will hold true or not, whether they'll arrive upon some kind of a deal, I do not know. But your viewing audience, no matter where they live, should contact their members of the House and their members of the Senate and let them know what they think about this legislation. And
finally, I guess businesses required to contribute, so this would be a cost on business then.
Very much so, and as you know, right now, an employer who doesn't offer health insurance is at a very severe disadvantage to those who do offer health insurance. So obviously the ones who don't would like to be able to do it, but most of them simply cannot afford to do it and stay in business.
Okay. All right, very good. Congressman Bob Goodlatte, representing Virginia's 6th Congressional District. Thanks for joining us.
Thanks, Bob.
And now let's send it back to Mel.